Hello friends, and welcome back to thepodlife.com. I'm Craig and I'm super excited about today's show. We've got on tap for you veterinarian Dr. Kim De La Peza. She's going to talk with us about GDV, gastric torsion, aka bloat. It's all the same thing as you're about to learn, so if you stick with us, we're going to break down for you all the details of how to prevent it, how to detect it, and what to do if your dog should happen to find himself in a case where his stomach has TORS. It's a life-threatening emergency and one that I think every trail dog owner should be aware of. So let me get out of the way and let's get right into the show. I'll see you on the other side. Hey everybody, Craig here from VCA Lakeside and podlife.com, and today we're going to talk about bloat or GDV. And I've got my friend here, Dr. De La Peza, who's going to explain some of the details. Most importantly though is that bloat is a very serious medical emergency for your trail dog, and if you think it's happened, time is going to be of the essence. So today we're going to explore how to find out if your dog is having it, symptoms to detect, what to do if you think that that's happening for you and your dog, where to go, and what to expect in the hospital setting, and lots of other great topics that circulate around this very serious emergency problem. So, but first of all, before we dive into it, let's meet our guest. So, Dr. De La Peza, thank you as always. Nice to see you today. So, can you tell us a little bit about yourself? Maybe where you went to vet school and just your veterinary background in general, so people have a sense of kind of who they're listening to.
Sure. So, my name's Kim De La Peza. I'm a doctor of veterinary medicine, graduated from Michigan State College of Veterinary Medicine. My focus is small animal. I do a little bit of mixed animal, but primarily small animal, dogs and cats.
Okay. And in that capacity, I think you do some general practice and some emergency medicine as well. Okay. So that must be exciting. Lots of opportunities to see a lot of interesting cases.
It is. It's great. I can see a lot of emergency cases, and then I get to follow up with them through a general practice setting. Yeah. So I can build that relationship, which is really nice.
Fantastic. Well, so I wanted to do this topic because of a friend of mine's dog named Lucy. So Lucy's a local trail dog that spends a lot of time chasing her owner around on his mountain bike and throughout the hills here of Big Bear. And they had an event where they were on a typical trail ride that they do all the time. They stopped at a creek crossing. Lucy drank a bunch of water, and then they continued on their ride and went home, and really wasn't anything going on. And about an hour and a half, later, 2 hours later, he called me and said, "Hey, Lucy doesn't look right. She's panting. She's attempting to vomit. Nothing's coming up. Her abdomen looks a little tense, but she just seems really uncomfortable. What's going on?" So I had him meet me at the hospital. We took an x-ray of the abdomen and we saw what we suspected to be a bloat condition and sent him immediately off to an emergency hospital because it was after hours. They performed emergency surgery to solve this bloat problem for this dog, and Lucy lived and continues to run around chasing mountain bikes today. But the thing that caught my attention is my friend said, "Hey, I never heard of this. This is a 13-year-old dog, German Shepherd. We've been taking excellent care of her, and they have very knowledgeable about her care, but bloat never came across their radar, and he had no idea. And so I thought, I feel a deep obligation here to help kind of spread the word. And so thank you for coming up to do this today, because it's my hope that we can get people kind of more educated on what is bloat, and how to, like I said in the intro, how to detect it and what to do if they think it's going on. So,
well, thank you so much for even bringing up the topic. I think it's super important because this is not something that's just like vomiting and diarrhea where you have the time to be able to monitor it to see what's going on. This is a true non-traumatic medical emergency. If you suspect this to be going on, you need to get your dog to a vet immediately. I mean, minutes could make a difference for this dog. And so it sounds like you guys did all the right things. He wasn't sure what was going on. He noticed the clinical signs. He called you. You guys did the diagnostics right away and sent her off to be surgerized
Yeah.
to have things fixed. So that's spectacular.
Yeah, I was fortunate, and so we felt like, you know, we were really lucky that that scenario went the way that it did, but it doesn't always go that way. And so, you know, but just, you know, being the people that we are, we thought we need to help get that word out. Well, maybe you can start out by helping us sort through some of the language here. So, you know, most people will refer to this condition as bloat. It's, you know, in the industry, we would probably refer to it as GDV, gastric torsion. So what are we talking about here?
So bloat, I guess, is a layman's term to just say the stomach is full of gas. But bloat is not actually a GDV. GDV stands for Gastric Dilatation Volvulus. And what that means is that the stomach fills up with gas and it becomes kind of like a big balloon. And it will twist or tors on itself. And so, as you had mentioned previously, a little air balloon, balloon animal, you twist it at both ends, all the gas gets trapped in the center, and that gas has nowhere to go, and so the stomach gets bigger and bigger and bigger, causing the clinical signs that we see that can lead to death. Death by rupture of the stomach, or death by sheer cutting off all of the oxygenation to the tissues that supply the body. And so those are two real important things to look at. But I think it's the bloating of the gas and the twisting of the stomach that causes all the problems.
So when people are talking about bloat, they're really only talking about one half potentially of this equation, meaning your dog could steal a loaf of bread and eat the entire loaf. It hits the stomach and the stomach acid and swells up, and now the stomach is tremendously bloated. That's a problem.
Correct.
And then in some cases, that bloated stomach may twist upon itself.
Correct.
And then we get the balloon animal. And so now as that stomach content is being digested, it's off-gassing, and so the balloon fills up more and more and could rupture and a whole host of other problems.
Correct.
Is this always a food-related situation, or in my friend's case, a water-related situation?
So we tend to see it more commonly with dogs that eat a large meal, gorge themselves, or drink a lot of water and are very active, or nervous or fearful dogs, high-stress situations. But those are not the only situations you can see it in. You can see it in any dog at any time. We do have certain breeds that are more predisposed to it. So typically we think about large breed dogs with deep chests. Males tend to be overrepresented as compared to females.
What's a deep-chested dog?
So deep-chested dog would be like a Great Dane, a Saint Bernard, a Mastiff, a Boxer, Weimaraner. So anything that when you look at them from the side, their profile, their chest from their back is nice and deep, and then it tucks up into the abdomen. And so most dogs are like that. Anything that has that deep chest, but any dog can be affected. I've seen or heard of guinea pigs, cats, small dogs, chihuahuas, dachshunds, any dog, but we tend to see it more commonly in male large breed dogs. But as you said, your friend's dog was a female and it happened to her, so it doesn't exclude by sex. Are
there any age categories that are more susceptible to this?
So older dogs tend to be more susceptible as compared to younger dogs. We don't know exactly why, but I would say 7 to 12 is about the average range, but you can see it at any age, any breed.
What should I be looking for as an owner?
So what your friend described initially is pretty classic. The dog is restless, the dog is panting, just can't get comfortable. Think about us after we eat a huge Thanksgiving meal. It doesn't matter what you do, but you're like, oh my God, my belly hurts. It's just super uncomfortable. So she's panting, she's pacing. You may notice that the belly starts to get a little bit bigger. The left side of her abdomen starts to distend a little bit. You may notice that she's trying to vomit, but she will not be able to vomit because the stomach is twisted. So whatever's in that stomach is not going to come out. But she feels the need to vomit. So she's retching, dry heaving, trying to spit something up, but nothing comes up.
That seems like a really important point, like vomiting, productive vomiting versus retching, non-productive vomiting. So if I'm seeing that and I call my local primary veterinary hospital and someone answers the phone, that would be a very important qualifier to mention my dog is attempting to vomit, nothing's happening, she's retching. That really helps that veterinary staff understand how to prioritize me as a potential patient that they need to get in immediately.
Absolutely. So non-productive vomiting, retching. Think about the person that's drank too much the night before and then they're starting to get sick. Once your stomach is empty, you're no longer producing anything, but you're retching. So that violent retching, trying to yak something up and nothing comes up, that's absolute emergency. Hands down, come in. I wouldn't even bother calling. I would just show up to your local local emergency.
Yeah.
But I would say likely an emergency would be better than a general practitioner. But if you only have a general practitioner, don't stop, just go.
Yeah, or call on the way so they can kind of prepare,
That too.
because it is labor intensive as far as the amount of people. So I know, being on the general practice side, we love to get a heads up call. Just all right, nobody's taking a lunch today. Everybody get ready. But like you said, it seems like
call in transit.
In
Don't
transit.
call and wait.
Yeah, and wait to figure out if you're getting an appointment or not. Any other physical signs? I imagine this big balloon is filling up inside this dog's abdomen. Will you see if physical changes to the body of the abdomen? Will you be able to, if you touch the abdomen, will it feel different?
Sometimes yes and sometimes no. It depends on the breed of the dog. I saw a Basset once that had a GDV, and I could barely feel the tension of the abdomen.
Just because it's such a large abdomen anyways. And okay, so anatomically the stomach was more forward.
Correct.
But if you're a Weimaraner and you're very lean,
correct,
it's more obvious. Okay.
And so what you may imagine, your dog has swallowed a dodgeball or a big rubber ball.
Yeah.
And you feel that ball-like area in the back abdomen behind the ribs. Left side tends to be bigger than the right, but once it gets distended enough, you may notice distension on the right as well. If you ping that side or tap it with your hand, it sounds very much like a dodgeball. You can hear that hollow thunk, thunk, thunk as you're tapping it.
Okay. So now I'm looking at
But at that point, your stomach has got to be really distended, and so you really need to get to the vet.
Yeah.
And if there's any question, don't even hesitate, just go.
So I've got this dog. We've got some non-productive vomiting, some retching. We have a drum-like abdomen that I can tap on. I imagine as these symptoms are happening, it's probably affecting the dog's ability to either breathe or to circulate its blood. Are either of those affected in the process?
Absolutely. So as the stomach gets larger, it puts pressure on the diaphragm, reducing the area within the chest cavity to allow the lungs to expand. It's also very uncomfortable and painful. In addition, once you start cutting off that blood flow, they start to go into shock. If you come home and find your dog lateral and unresponsive on the floor, that's a potential sign of what's been going on for a little while. So yes, those are all signs. Absolutely.
Okay. So we see these things and we know we've got something going on. Whether we know or not, we're in the vehicle, we're heading to the emergency hospital. What are we looking at when we arrive at the veterinary facility? What kind of things would a client expect to have happen once they walk through that door?
Well, so hopefully the client has called and the receptionist has realized that this is an emergency based on the fact that the client says, my dog is pacing, panting, seems uncomfortable, is not vomiting, is retching, and the receptionist, that's her clue right there that this is an emergency. This has to be seen right now. She tells the client to come in, be safe on the way, but come in right now. Techs get ready. They're setting up IV catheters. They're setting up fluid bags. That pet gets to the hospital. That tech triages that pet straight to the back. Just straight to the back. Pet comes to the back. We take that lateral x-ray so long as the client says okay. So x-rays, exam, IV catheter placement once we determine it is a GDV. Very proactive fluids. Typically we place 2 IV catheters, 1 in each leg, and we've got fluids running to both legs because we want to get that body perfusing as fast as possible. We want to move the toxins through the system as fast as possible.
Okay.
If we can sedate that dog and pass a tube down the throat, when we pass that tube, that stomach, there's a chance that it will untwist. We get that tube into the stomach and we get that gas coming out.
Are you doing this on an awake animal?
Sometimes, yes, depending on how sick the animal is. Other times with sedation. And so your vet may come up and very quickly say, I need a $500 consent to be able to snap some x-rays and get some lab work.
Or more, right?
Well,
I mean, if
initially,
you're talking
x-rays, lab work.
Yeah,
and
lab
then
work.
once we determine it's a GDV, then yes, it is more. Because you have to place catheters, run fluids, do lab work, sedate the dog, pass that tube.
Why lab work? We know the dog's got bloat. We know. Let's just say we know. Like they're mysterious to find, like your Basset, so they don't present super obvious. But let's say a super obvious case comes in, big distended abdomen, hard time breathing, lethargic, retching, and we're like, oh, we have a bloat case. Maybe we're fortunate enough to just go straight and get an x-ray. And so we're like, we've got a bloat. Why do we need lab work? Why don't we just go right into the procedures?
So we need lab work because we need some sort of baseline. What are our liver and kidneys doing right now? Where's our lactate? What are our electrolytes looking? What do the rest of our parameters look like? All of those things, we have a baseline. So after surgery, if things aren't going well or if things were abnormal before surgery, we have something to compare to. So if we go straight to surgery and then after surgery, let's say a day or two later, our pet is not eating, not doing well, and we run lab work and we notice kidney values are elevated. Well, now, is that a post-operative complication? Did it happen after the fact, or was that there from the beginning? Maybe your dog had elevated liver and kidney values before the dog even got sick with bloat.
Sure.
How do we know? And so
Okay.
that's another reason why it's so important to have annual lab work, because again, then we have something else to compare to.
I see. So, who knows? Maybe, my dog's walking around with kidney failure,
Right.
and we just didn't know. And so we've got to know that ahead of time so we understand what's happening as we move through the
Correct.
various stages of recovery, because it sounds like there's some complications that can happen.
Absolutely.
So before we dive into that, as we walk through the door and we do our initial assessment and they go straight to the back, do owners go with them to the back?
No.
How come?
Well,
Because they always want to go.
It's an emergency situation.
Yeah.
And so for us to be able to do what we need to do, we need to get that pet back there, get that pet into X-ray, and get the IV catheter placed. Sometimes it's more stressful for the client to watch these things happening and they don't understand. So we have to take time to explain to the client, and that's taking away from the emergent setting for the pet.
Okay.
The other thing is radiation with X-rays. Clients cannot be exposed to that. It's state law. And so allowing us to be able to take care of that pet, just like when a kid or accident victim goes to the hospital, if that patient is sick enough, they get triaged straight to the back. And mom doesn't go,
Yeah.
boyfriend doesn't go. They wait until that person is treated. Once that person is a little more stable, we have a little more information, we come back up and we update the client.
And I think my techs and assistants would say, they're going to do a better job at the difficult work of placing catheters and things
Yes.
like that if they don't have an owner just staring at them, adding that extra pressure. So you want the assistants helping your patient to be as successful as
And some pets tend to be
possible.
better when the client is not there.
Just like
believe it or
my
not.
kids. I mean, if I'm not there, they're way easier to work on. If I'm there, they're doing all kinds of funny things. Yeah, it's for me, part of the show, right?
Sure,
Yeah,
sure.
pets are no different, are they? So we've gotten our X-rays, we've gotten our blood work. The doctor and team are around this animal. Depending on how compromised it is and how advanced the condition is, it may be so compromised that you can just attempt to pass a stomach tube on this animal with no drugs involved at all. Maybe not. If not, you're going to do potentially some sedation, potentially some anesthesia, but in some form or another, first step is going to be to see if you can pass a stomach tube through this balloon animal, right?
Correct.
That's potentially tore. So you've got to, and if the stomach is full of air and putting pressure on that little balloon animal twist, what's that like? How hard is that to do? How does that happen?
It's quite difficult. And so as an emergency clinician, I want to make the diagnosis. As soon as I make that diagnosis, I want to place my catheters and start running fluids. I want to get consent from the client to be able to anesthetize that pet.
Because this
And
is
so-
risky. At this point now, we have an animal that's in a very advanced risk category, I would assume.
Anytime that stomach turns, anytime that stomach twists, we are in an emergency situation, and minutes, it's important. Time is of the essence. You need to get things done fast. And so we're working in crisis mode, right? And so we're getting that catheter. We are anesthetizing that dog so long as the client consents. We anesthetize that dog. We pass that tube if we can pass it. So the tube, the idea is you take it down and you kind of move the dog as you're passing that tube, and hopefully you can get it through that twist of the stomach. When you pass it, a lot of times what will happen is that stomach will untwist, and so now it's back in the normal situation. Doesn't mean all the problem is done though. We still have a lot of serious things we have to worry about, but we pass that tube and relieve the pressure on the stomach. If for some reason we're not able to pass that tube, we can do something called trocherization. So you take an IV catheter, a very large bore or large needled catheter, and you poke it into that area of the abdomen where it's tense and full of air, because that stomach wall is right up against the abdomen muscle, and you poke it straight in and allow it to decompress out into the environment. You can actually hear the air swooshing out as you go.
Okay.
And so the idea is you're getting the gas out of that stomach to relieve some of that tension, to allow a little more circulation to the body, and hopefully be able to untwist that stomach back into the normal position.
And because this is it's a large gauge catheter, but it's still a catheter, so the hole is small enough that you're not when you pull this catheter out, finally, you're not exposing gastric fluids and things
Correct.
to the free abdomen inside, but you've gotten all this air out, or at least you've gotten enough air out to hopefully aid you in passing that stomach tube and potentially detorsing or untwisting that stomach. Let's say that all goes beautifully. You've passed your stomach tube. You didn't even have to trocarize. Stomach contents are coming out this tube, I imagine, if there was food in the stomach.
Correct.
Maybe not, if it's just water, or, like you said at the beginning, it's not always a food related item. They can
Correct.
tors even without food. So you've passed all this stuff. Are you done? Wake up the animal and send them home?
That's
congratulations.
the tip of the iceberg.
Okay.
And so once you decompress that stomach, the idea is you're going to roll into surgery. You're going to do a full abdominal explore. So cut the dog from the sternum all the way down to the pelvis. You open things up because you need to check the tissues. Are the tissues healthy inside? Does the stomach tissues on that stomach look nice and pink? Does the spleen look good? Do the intestines look good? Because when that stomach twists, it cuts off all the circulation and all the oxygen to those organs. And so there's a high chance that those organs become permanently damaged from lack of oxygen. And so you need to look at those tissues. And if they don't look healthy, there's a chance that you go in and you have to take the spleen or take a portion of the stomach or take a portion of the intestine. Unfortunately, though, some dogs, when you go in, the tissue is so devitalized that euthanasia is recommended. And so pets can die from this disease for a number of reasons. They can die because the stomach bloats and ruptures. They can die because they go into shock before they even get to the vet hospital. They can die on the table because they are in shock and for reperfusion injuries. They can die because the tissues are so damaged. If we do go and take some of those tissues out, they're at high risk for complications after surgery as well. And so they can die once they're out of surgery and recovering from surgery. So there's a lot of risk involved. And it's super important when your vet comes out and talks to you about these things that you're able to comprehend the severity and the gravity of everything that's going on. And realizing that even if everything goes perfectly during surgery, there are a lot of complications post-operatively that can't be avoided that your pet can pass from.
This is a really interesting arena. Just thinking about it as from a hospital manager's perspective, a 30-year veterinary assistant working in the exam rooms and talking with clients, and I'm just recalling so many scenarios where owners were having a nice day doing whatever they were doing, and then suddenly they're confronted with this. And so here's your beloved friend, your furry friend that you've had for however long you've had, but you're emotionally connected. You hit the emergency hospital, out comes a team, things are moving fast, and they tell you two things. One, your dog has this medical condition that he could die from, she could die from, and two, it's going to cost a lot of money. And so now you're struggling as an owner to navigate these really choppy waters of, I've got a mortgage to pay, I've got car payments, I've got kids, I've got whatever I've got, and you're telling me this could be $2,500, $3,000, it's going to be more money than I have available. And so sometimes folks are going to have to choose euthanasia humanely because simply they don't have the financial capability to take this dog through a really rocky treatment process. Right? Meaning you're going to rack up $2,500 or more. I'm just throwing that number out there. It's a general ballpark depending on where you live, but you're going to rack up thousands and thousands of dollars, and the outcome is not guaranteed.
No. And so I would say 25,000 or 2,500, I should say, is a very, it's very low.
Yeah.
In my experience, you're looking at anywhere from 5,000 to 7,000. In some specialty clinics, you could be looking at upwards of 10,000. It just depends on where you are.
Sure.
And what the finances are of that clinic. And are you having specialists cut your pet or not?
Yeah.
And how many days post-operatively does your pet need to stay in the hospital? And how complicated was the surgery? If we go in and your vet is able to place it, if you notice the clinical signs right away and get straight to the vet is able to take those x-rays, place that catheter, pass that tube and decompress that stomach, and you get into surgery and all the tissues look nice and healthy, all we're going to do is pexy the stomach to the body wall, meaning we make some special cuts and some special incisions and sew the stomach up against the wall so it can't turn again to prevent it from happening. But if all the tissues look good, we're not taking out the spleen, we're not taking out portions of the stomach, we're not taking out of the intestine, or pieces of the intestine, and so it's going to be a lot less expensive in that sense. We sew your pet up, recover your pet from surgery. Your pet does need to be monitored in the hospital for a few days. The goal is to get your pet eating and able to tolerate oral medications with a normal blood pressure. We also need to monitor heart rate and rhythm. They are prone to abnormal heart rates and rhythms after the surgery. And so as long as we're not having any of those abnormal rhythms and your pet is eating and doing well, then maybe you got lucky. Maybe you got there early and your pet is going to do okay. But in some situations, when a pet comes in shock, lateral, unresponsive, I'm going to say that the prognosis for that is very poor. We are already to the point where we are systemically ill. And so I would be pretty fair to say that the tissues are probably pretty damaged and devitalized by that point.
And what is the role of the veterinarian in this? And in that, I think sometimes people think that the veterinarian just wants to, a chance to cut is a chance to cure. We're going to do surgery. What should owners expect? Will a veterinarian be truthful with them? And is it possible for a veterinarian to foresee what the outcome's going to be until they go in and do surgery?
So we have prognostic indicators, right? And so it's kind of like somebody buying a car. You assume that if you buy a brand new car with, nice suspension and nice tires and a great motor, that it's going to last you a long time. Versus if you go and buy a 15-year-old car that's beat to heck, that hasn't had regular oil changes, the prognostic indicators for that car are not going to be very good. It's probably not going to last very long. And so when we look at your pet coming through the door, you telling us a really good history, letting me know how long has your pet been exhibiting these clinical signs, what's been going on, does your pet have any previous medical concerns? Those things can influence how the pet does in surgery. What the dog looks like walking through. Is the dog comfortable? Is the dog lateral and has to be carried in? Those two things are good prognostic indicators. And then we start looking at lab work. Lab work can be a prognostic indicator. Do we have changes in the lab work to show things are abnormal? Is our lactate elevated? Are our kidney values normal? Liver values? If our lab work is looking normal, then potentially maybe we've caught this early, and hopefully that's a good sign that things could go better. But you're never going to know for sure how things are going to go 100% until it's done, right? Hindsight is 100%.
And I assume you really don't know the moment in time, specifically when the stomach potentially so you don't know when the clock started ticking, so that animal could show up and you don't know if it's been 2 hours, 4 hours, 6 hours, 1 hour. You just know based on the clinical signs that you see externally, that like you described, this dog is standing on its own, it's not panting, it does have some retching, there's some mild tension in the abdomen, but otherwise, versus the different from that, a debilitated animal. Right. And then maybe next stage is now you start to run some diagnostics like your blood work, and you see, wow, we have some blood work indicators.
Right.
Can owners take these things in a stepwise fashion? They're staring down the barrel of potentially a 2,000 on a good case to a 10,000 on a very, very bad extended case with, risky prognosis. Is it all or nothing, or are there steps where they can kind of, let's go to the next step, and if we don't like what we see there, the blood work looks terrible, then we're going to have to make that hard decision. Or the blood work doesn't tell us much more, we're still willing to go to surgery, we go to surgery, and then we find out some things. Is it reasonable that they call it on the table for these dogs? How does this work for people as they're navigating this? Yes,
it can be stepwise. The first step, getting through the door. The second step, consenting to the X-rays and IV catheter placement. Once we determine that it's bloat, then we have a quick conversation. Hopefully we've already pulled blood and we've got that blood sitting, getting prepared to be run. We run that lab work, we review that lab work, and then you make the decision. Yes, we're going to surgery, not going to surgery. Are we going to pass a tube to see if we can make the dog better? And we update you if we were able to pass that tube. But we don't have a whole lot of time with this type of disease. We don't have a whole lot of time between the steps. It's not like you can stop and call your mom and call your brother and have a conversation and think about it. This is a disease or a situation that time is of the essence. We need to make fast decisions. And it's difficult because we've got money and emotions involved and your pet's well-being involved. And so it can be challenging. I do think, though, that things can be taken on a somewhat stepwise fashion. You know, you don't have to commit to a $10,000 bill, right? You do those x-rays, you do the lab work, we update you, let you know. If we can trocar that stomach and pass a tube, now we have a little bit of time to talk and think because we've decompressed the stomach. It's no longer TORS. Now we need to think about where are we going to go from here and what we can do. Right. I've had clients where they don't have the money and all I've been able to do is pass that tube and decompress that stomach. It is not ideal because I cannot tell that client without looking at that tissue and going to surgery if that pet has any devitalized tissue. But if that's all I can do and it's a matter of the client not wanting to pursue anything more and not put the dog to sleep, and I think that that dog clinically is walking and looking okay, then we can try it. But the client needs to understand that there is a risk that if that tissue is devitalized and we don't go in there and address that, then that dog can die from that. And so as long as all of the options are on the table and the client consents to everything and understands the pros and the cons to things, we can do different things. But in an ideal situation, when your dog comes in with a gastric dilatation and volvulus, time is of the essence. Getting that dog into surgery to pexy that stomach, to look at those organs, to take care of any organs that are devitalized is what's needed. Post-operative care in the hospital on IV fluids with monitoring, and then plans to go home if everything goes well. If the client decides that they can't do that because they can't afford it, or because the dog is old, or because the dog has some other underlying diseases, I understand that, and it's okay to make the decision to let the dog go and to make the decision for humane euthanasia. There is no guarantee that even if we have all the money to do what we need to do, that it will be okay.
Sure. So I want to, you mentioned something earlier I want to backtrack to a little bit, but let me set the table. So we're in surgery and things are going well, and we, pexy, and we find that the spleen is looking good, and stomach tissue is looking good, everything's looking good. Great. And we've just detorsed that animal and we're preparing to do the pexy. You mentioned reperfusion problems. Can you tell us a little bit more about what that means? What's happening with reperfusion?
Sure. So imagine a garden hose that has been kinked and all that water's built up, and now you let that hose go and it goes blasting through all the things that are within the blood, all the toxins that have been built up that are normally constantly filtered by the liver and kidneys are now all of a sudden getting blasted into the body. And so it's a reperfusion. It's shock to the pet, shock to those organs, and that can cause a lot of damage to those organs.
And so organs involved would be like liver, kidneys,
spleen, intestines. Mm-hmm.
And so these are all filtration organs, basically. What does the spleen do? If oftentimes it seems like with these types of surgeries, you find out that the spleen has been damaged because of the loss of blood supply, and you do a splenectomy.
Well, the nice thing with a splenectomy is dogs can live without a spleen, kind of like a person with an appendix. So that spleen can be taken out, and a dog can do great without that spleen. Liver, on the other hand, is a whole nother story. And so you can take parts of the liver and they can be okay, but you can't take all of it. Can't take all of the stomach. But the spleen is an organ that, luckily or fortunately enough, we can take it out if it's damaged.
Okay. So assuming spleen is fine, assuming liver and kidneys are fine enough, I mean, they're obviously undergoing some kind of trauma and now assault from toxins in the bloodstream. What kind of things happen to these dogs? They have, trouble with their heart. They go into shock. And how long are we worried about this reperfusion injury time? What is the window for that after surgery?
So typically I say 72 hours after surgery, if the dog is doing okay, eating, drinking, no abnormal runs of these abnormal rates or heart rhythms, then the chance of the dog going home and doing well is much better. But typically we see it within the first few days. Sometimes it can be a little bit longer, but you're going to see other signs. Your pet is not going to be doing well.
Okay, yeah. But if they're doing well, then we would see dogs that are starting to just look like they're happier, more comfortable. At some point, they're going to have some interest in food and water. Yes. So if they're eating and drinking and holding those things down and happy to see owners at visitation, you're trending in the right direction, and hopefully you'll be
So things that I'm looking at post-operatively, Recheck lab work. Does that look good? Does it look better than when we came in?
Now our baselines come into play because we can look and say, gosh, when you came in, everything they were at these levels. Now we're seeing deviations from those. Okay.
So are those levels the same? Are they better? Are they worse? And then the clinical picture I'm sorry, ECG, so we're monitoring heart rate. Are we noticing normal heart rates and rhythms, or are we noticing a really fast heart rate? Really fast heart rate runs of VPCs are abnormal, and we may have to intervene with some medications to do that. Poor prognostic indicator if we have those things. Doesn't mean your pet can't go home and be happy and healthy, but that's another little
And VPCs are a type of arrhythmia that's basically showing us on these ECGs where we're monitoring the heart rhythm. We can see a normal beat pattern, and then something funky where something's missing.
Fast.
Okay, and then back to normal, and so
Correct.
now we know, hey, that's something that is most likely attributable to this reperfusion, or this dog just basically trying to get back to normal from.
And there are runs of those. It's not just one here, one there. So what I'm looking for is lab work. What does the lab work look like? What does the heart rate and rhythm look like? Continuous ECG for 24, 48, 72 hours. And then the clinical picture of our pet. Are we eating? Are we comfortable?
Yeah.
Can we get up and walk and go outside and go to the bathroom? Are we interested when mom comes to visit or dad comes to visit? Are we interacting with the staff? And so the clinical picture, as long as our pet is eating, drinking, comfortable on oral pain medications, and lab work and diagnostics are normal, I see no reason why the pet can't go home.
Okay.
If we've taken parts of the stomach, if we've taken parts of the intestine, those have complications in and of themselves, and you can see dehiscence of the joining of the tissue from the intestine or the stomach up to 5 to 7 days after surgery.
Okay.
And so those make things more complicated. Those types of complications may require that our patient stay in the hospital longer.
Okay. And so I think the number one preventative here is to, you've done this pexy, this gastropexy, where we are basically attaching the stomach to the abdominal wall so that it cannot turn. Right. Is this the only time to do this, is when your dog has bloated?
No. And so it's really good to be proactive, right? If you can stop something from happening, it's preventing it from happening is much, much better than dealing with the aftermath. And so what I tell people, if we have an at-risk breed, large breed dog, deep chest, thinking about doing those pexies when we spay and neuter them when they're young. So when you spay a dog, you're already in that abdomen, and so it's just a little bit larger of an incision, and you're going a little higher up, and you do what's called a prophylactic pexy. And so you're going to tack that stomach wall to the body wall when the dog is happy and healthy and doing great, to prevent the stomach from turning later on in life. Doesn't prevent bloat, so that stomach can still fill up with gas, but it's not going to. It's going to prevent the life-threatening torsion, twisting of it.
Okay.
When you neuter your dog, we're not going into the abdomen, but we can go into the abdomen and do that pexy. You could do laparoscopic surgery where they're making small incisions in that abdomen and going in laparoscopically and tacking that stomach wall to the side. And so there's lots of things we can do like that. Other things that you can do other than surgery would be feeding your dog multiple small meals a day, at least 2 meals a day, but definitely not one. When you feed one, they tend to gorge more. When they're active, try not to give a lot of food and water when they're active. I mean, yes, your pet needs to stay hydrated, but just small volumes of water throughout the course of your activity, not large volumes all at once. Types of food that you can feed can make a difference. Weight management, you don't want them too heavy, you don't want them too lean. Stress for a pet.
So even too lean of a dog, this could be a problem for.
Stress, anxiety, fear, aggression can all be predisposing factors as well.
Amazing.
And so trying to keep your dog in an optimal setting, but definitely thinking about a pexy early on. That pexy early on may cost you an extra $500 at the time of your surgery when they're young, but think about the money that you're going to save and the potential life-saving measure that you're taking. Your pet could go on to live a happy, healthy life for many, many years to come because you pexy that pet as a puppy or as a young, not a puppy, but a young dog.
Sure, yeah. We talk about this a lot with folks that have these active trail dogs where they're hiking, they're trail running, they're riding mountain bikes with their dogs, and people get excited. They get backpacks for their dog. I'm a big advocate of all of these awesome backpacks and water bowls, and we sell lots of them here. But when you're a new pet owner and you're looking forward to having this fun with your animal because that's your lifestyle, you buy these backpacks and then you put food in there and you take them out for an hour-long trail run, and you feel like you're supposed to give these guys some food, or like my friend, let them hit the water. And so we talk a lot with them about really for an hour or a 2-hour exercise event, even a fast-paced one like that, there's really not a caloric need for these guys to replenish until they get back. And then when they get back, they're going to want to eat a lot of food and drink a lot of water, and they're still at risk in those moments, and you need to be careful about regulating the amount of water and not letting them gulp tremendous amounts of water down and then do anything else.
I agree.
Yeah, so yeah, that's always a tricky one, and that's what stung our friend was, older dog working hard on a trail ride, hit the stream, and it seemed natural to let her just, really take a lot of water down, and that's what ended up being the problem, big heavy stomach. But as a reminder, what you told us in the beginning, there are some dogs breeds that are more predisposed, so dogs that are deep chested with a big chest and a narrow waistline, large breed dogs that are definitely over 100 pounds have a way greater risk. It can happen to any breed. Doesn't have to be food or water related, but that is a risk factor. And so, lots of food and then playtime right after that, or lots of water and playtime right after that is a risky situation. So watch out for that. Prevention methods would be the PEXI. Financially, I would say look at carecredit.com and get yourself a Care Credit card, because nobody ever arrives at the animal hospital and says, "Hey, I got a couple $1,000 I was looking to burn today. So glad I had a bloat and a torsion with my dog."
The other thing too is dog insurance. Get some insurance when your dog is young and healthy.
Like Trupanion is a great company that we do a lot of work with. There's a lot of them out there, and there's no sponsorship in this show today, so we're just mentioning these guys because these are the real tools that we use every day as we see these animals come into the hospital.
Healthy Paws are the two that I find that are great.
Wonderful.
And all insurances are not created equal, so you need to make sure that your pet is covered for what you need.
And maybe ask your veterinary hospital, because they most definitely work with them, and so see who they're working with and who they're recommending. That might be a good place to start. But most definitely you can apply for Care Credit in 5 minutes online and find out, and that's a really nice program, interest-free for a period of time. So I love mentioning it just because at the animal hospital, we want to work on your pet. We want to save your pet if that's what you want to do. And so often finances end up, the rock between everything. And so if you can spend a few minutes and arrange a financial backup for you just for your pet, what a it's just nice for everybody to be able to do what they want to do and take some of the financial pressure out of the equation. But
it's a lot of pressure for us as veterinarians too, to think that this is something that we can do to save your pet. But because of the finances, we can't move forward. And so it puts a lot of strain on us as well.
It's a stressful, we talk about this on almost every episode. We end up talking about the stress of being on the other side of the treatment door, on the veterinary professional side, from doctors to receptionists to technicians. And it's an awful situation to be in when you have to be the person to let that owner know that, one, your dog has a very serious disease like GDV going on, and the prognosis is very poor. And oh, by the way, this is going to be more money than most people have around, and could be, that could be the reason for euthanasia. That's a tremendous toll, and it's not just the veterinarians working on these dogs, is it? Do you do all this by yourself then?
No, it's a team effort. It's a team effort from the receptionist answering that call, getting that patient through the door, the technician triaging that patient and coming back and helping me place the catheter and get those diagnostics done and get that dog stabilized and into surgery. So it's a huge team effort. The team that takes care of the dog post-operatively as well. It's a collaborative effort for sure.
I know a lot of vet staff listen to the show, so I just always try to take a moment to say thanks, because you guys are from the top to the bottom, from the front to the rear. I mean, the reception staff that are able to detect these calls, because when owners call in, they describe all kinds of symptoms, and you have to be able to ask the right questions and figure out what's on the other end of that phone. And you can't see the patient, you can't see the owner, you can't see the circumstance, and you've got to figure out if this is, what we're doing with this. To the technical team that are able to, in the heat of the moment, they can get catheters in these animals that have low blood pressure, almost the ability to put a catheter through the skin, bullseye, into a vessel, thread that in there.
And then tape it in and get it to stay.
Just amazing, right? And these are the guys that are monitoring anesthesia during these high-risk circumstances. So thanks, you guys. It really makes a huge difference. And I know we
couldn't
really
do what I do without my support team, for sure.
Not a chance.
For sure.
Well, Dr. De La Peza, this has been fantastic. Thank you very much.
Nice
we really
to talk
appreciate it. We hope you guys have enjoyed this today, and you've given you some good tips to try to keep an eye on that. If you like the show, please do us a favor. Subscribe to us and give us a review on YouTube or on iTunes. That's the only way we get any reward for what we're doing here, and it allows us to keep doing it. So we're really enjoying doing it. We want to keep doing it as long as we can. And thanks to people like Dr. De La Peza, we hope we'll be able to keep that up. So take care, everybody, and thanks for your time today.
Keep making a difference.
That's it. Thank you.
You're welcome.
Well, that's it, everybody. I hope you enjoyed the show today. I want to give a very special thanks to Dr. Kim De La Peza for taking the time to come out and help us understand more about bloat. It's a giant topic for all of us that run trail dogs and are active out there, and so I really appreciate that she would do that so we can all benefit from her years of knowledge. If you enjoyed the show today, please do us a huge favor. Click onto YouTube or iTunes, like, subscribe, leave some feedback. It makes a giant difference for us, so I really appreciate that you would take the time to do that. If you've got feedback or suggestions for future topics, please hit me up directly at craig@thepodlife.com. I would really like to hear that. And until then, I hope you get out there and have some fun loving on your dog out in the great outdoors, and we hope to see you out there ourselves soon. Take care, everybody. Bye-bye.